and welcome, Douglas County community. Thanks for joining us this evening in our continuing series around social emotional learning and wellness. My name is Jamie Montoya Smith. I'm the prevention coordinator with Douglas County Schools, and my counterpart in Douglas County, Lori.
Hi, I'm Lori Lacombe, Healthy Schools Coordinator. Thank you so much for joining us tonight. This is going to be good.
So this evening we have with us Danielle Barcelo and Serena Pont, and they are from Denver Springs. And Denver Springs provides a variety of mental health services in our community. They're located in Inglewood, and they've been a really great partner ever since they've opened up. And they provide outpatient mental health treatment. They provide inpatient mental health treatment. They have substance abuse programs, and they also have a specialized program for child and adolescents. And both of these therapists work in the intensive outpatient group therapy, and that's what they provide for our community. And so without further ado, they're going to be talking with you this evening about the teenage brain, substance use and abuse, things like that. But it's really good information for you as parents. So without further ado, Serena and Danielle.
Hi, everyone. I'm Serena, and we've got Danielle here on the phone. So I'm just going to get our presentation started. Let me get that going. Okay. All right. So like Jane had said, we're going to talk today a bit about teenagers and substance use, ways to have conversations with your kids about drugs and alcohol, whether they're using already or they're not using just yet. All right.
Yeah. Can you hear me? Okay.
Yes.
Okay. Great. Hi. Sorry I couldn't make it on the video, but I'll be here by audio presenting. So I'll start. So we got the tips to help avoid teen substance use. So what is substance use? What is the substance use disorder? Well, according to the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition by the American Psychiatric Association, defines substance use disorder as a problematic recurrent use of drugs or alcohol that causes significant distress or impairment in a person's life. So there's 11 different criteria that a teen would have to meet in order to meet criteria for this disorder. And it varies. So it could be being a danger to themselves or others. It can be having relationship problems, failing to meet their responsibilities, having withdrawals, building up a tolerance, using in longer or larger amounts, having problems quitting or controlling their use, spending a lot of time using, having physical or psychological problems, or giving up activities, or having cravings. So there's different severity levels. Starts with mild, so that's if they meet 2 or 3 of those symptoms. Moderate is 4 or 5 symptoms, and then severe is 6 or more symptoms. And sometimes it could be an early remission, and that just means not meeting the criteria for more than 3 months and less than 12 months. And that doesn't count cravings. So there are different types of substance use disorders like alcohol use disorder, tobacco use disorder, cannabis use disorder, there's stimulant use disorder, hallucinogen use disorder, opioid use disorder, a lot of different disorders that a teen can meet criteria for. And Serena will actually go into more detail about different drugs and substances in a little bit. So addiction, what is addiction? It's a complex condition. It's a brain disease that's manifested by compulsive substance use despite harmful consequences. So the term acknowledges that addiction is chronic but treatable medical condition involving changes to the circuits involved in reward, stress, and self-control. So if a teen if they keep using drugs or alcohol, even though they know it's causing them problems, this is definitely an indication of an addiction. And it changes a teen's brain, especially with their brain developing. It definitely changes it. It changes the brain function over time, and also the brain's natural inhibition and reward centers. And it keeps a teen from exerting control over their impulse to use drugs, even when there's negative consequences. So it's a big indication of an addiction. So co-occurring disorders is a big part of substance use and a mental health condition combined. Basically, you have a substance use disorder and a mental health condition that a teen might meet criteria for basically at the same time. So as you can see, 1 in 5 adolescents have a mental health disorder or meet criteria for one. And the most common disorders are anxiety disorders, depression, ADHD, which is attention deficit hyperactivity disorder, and young people or teens may struggle also with bipolar, schizophrenia, borderline personality disorder. So the mental health disorders and substance use disorders are tightly linked. And oftentimes the mental health disorder goes undiagnosed and untreated, which causes a teen to self-medicate or self-treat with drugs and alcohol. So, the disorders I mentioned, the ADHD, anxiety, even PTSD, which is post-traumatic stress disorder, and depression, can actually all increase drug use and dependence. So the substance use, it poses a serious risk for developing a mental health disorder. And so identifying these mental health disorders can actually reduce substance use. And so reducing that substance use can also improve outcomes for mental health disorders. So risks and protective factors. This is a big part of what I'll talk about in a little bit, which is MST, Multisystemic Therapy, and it really treats the adolescent substance use by looking at their ecology, which includes themselves, their family, school, peers, community. A lot of different risk and protective factors go into substance use for teens, and looking at these factors can help prevent substance use. So depending on an adolescent's history, they could be more vulnerable to substance use. So if they've experienced trauma, abuse, they may be more likely to be diagnosed with a substance use disorder. There could also be genetic vulnerability, prenatal exposure to alcohol or drugs, and lack of parental supervision and monitoring can also be a risk factor, as well as their peers using substances. Sometimes we see, peers, breaking the law. We might see school trouble, as well as just easy access. So some protective factors that are important to mention are, emotion regulation skills, coping skills, problem-solving skills, having high self-esteem, being connected with their family and school and community, having supervision and monitoring at home, having supportive relationships, having maybe a mentor, a lot of different protective factors. I'll let Serena continue.
Yeah. So we talked a bit about what substance use is in teenagers. And so now we're just going to get a little bit into the why. So this was a survey done a little while ago with a group of teenagers and just basically asking them, why do you use the substances that you do? And so you can kind of see here that we've got a range of, the teens wanting to have fun, to relax, to feel good, forget about their troubles, to experiment, to relieve boredom, to deal with the pressures and stress from school, to fit in with friends, and to deal with problems at home. So we've got quite the range of why teens report that they use. And then kind of just talking a bit about the adolescent brain. So the thinking brain, which is our prefrontal cortex, isn't fully developed until around age 25. And so teens have the judgment, but not the ability and skills to always use it. So they might know what's right or wrong, but they don't always know to really rely on that right or wrong to make those decisions. The teen brain also goes through a growth spurt, which leads to an increase in risky behavior and a disregard for negative consequences. So this is similar to, when your child was younger, 2, 3, 4 years old, running around, learning how to walk, putting different objects in their mouth, might be going towards moving objects and might not be afraid of certain animals, and they might go after like the bonfire or something. At that time, your infant and your toddler is going through a brain growth spurt. Their brain is really just taking in all the information of their environment and learning. A similar thing is happening with your teenager's brain. They're going through another growth spurt. They're a little more reckless, and they're really just trying to take in all the information of their environment. Substance use during this critical time can stunt the thinking brain growth. And so, we have legal pieces that help us. Individuals can't drink until they're 21. Here in the state of Colorado, unless you have a medical card, you cannot engage in smoking marijuana until age 21. And so there is science, and the government backs us up on the science, that if we can push substance use later on in life as much as possible, we definitely give that prefrontal cortex thinking brain more time to develop more appropriately without having that stunted growth with substance use. And use of addictive substances during adolescence makes it more likely that they will be addicted as an adult. Again, this is a critical period of growth, and so they're essentially training their brain to rely on these substances at such a young age that as they continue to grow, their brain is going to continue to rely on those substances because it's in this critical period. About 60% of teens engage in potentially dangerous behavior. Impulsivity peaks at 15 years old, and then it tends to drop off after that. And thrill seeking can be positive. So as much as we sometimes think that this impulsivity and risk taking is a negative thing for teenagers, there's definitely some positives to it as well. This is when you'll see your teens wanting to meet new people, wanting to try new sports, learn new things, maybe learn an instrument or start engaging in art. They want to increase their circle of friends. These are really great ways to increase their growth as an individual, learning sort of who they want to be in the world. This is a really critical period in which that thrill-seeking desire can be turned to the positive. And lastly, teens value rewards more than consequences. So the teenage brain is, like I said before, they have the judgment, but they don't know how to use it. And so they're going to focus more on the rewards of things than they are the consequences. So think immediate gratification. Teens are going to want that immediate gratification of whatever their drug of choice is, more so than they're going to think about being grounded for 2 weeks. And so lastly, teens rely on their feelings and impulse more than they do logic and planning. So again, that immediate gratification is incredibly important to teenagers. Take it away, Danielle.
Can you hear me?
Yep, I can hear you.
Okay. Okay, so some stats. Sorry, I lost my spot. Yeah, so here's just a few stats on adolescent substance use. So over 2.3 million adolescents between 12 and 17 and 7.7 million young adults between 18 and 25 used illegal drugs or misused prescription medication in the U.S., and that was in 2014. And then about 2.9 million adolescents and 20.8 million young adults, more than half of the young adult population consumed alcohol in the past month. And, I don't have any stats on marijuana, but as you can imagine, it's definitely a prevalent issue in Colorado and because of the legalization. And so over here, you can see that 1.3 million adolescents ages 12 to 17 need addiction treatment. And that was in 2015, and only 6.3 received it. So it's definitely overlooked. It could be underdiagnosed. Resources just might not be available or accessible, or just really the knowledge and awareness might not be there. So I think bringing more light and awareness is really important in getting, not only in preventing, but also getting the right treatment for it. Okay, Serena?
Yeah, and so now I'm going to talk a little bit about what teens are specifically using. So I have them kind of divided in their subcategories. First, we've got depressants. So this essentially means these are substances that are going to dull their emotion. You're probably going to notice more sleepiness, slower reaction times, if your teen is using these particular drugs. And so some depressants would be alcohol, marijuana, and benzodiazepines. So benzodiazepines are things like Xanax, Klonopin, Valium, Ativan, those really strong anti-anxiety meds, and even sleeping pills as well. And so one note on the benzodiazepines, sometimes teens are getting these drugs from their own medicine cabinet. And so it's really important that if you have any of these strong prescription drugs, that we have these locked up and away from teenagers. And then we've also got hallucinogens, so MDMA, ecstasy, LSD, ketamine, and magic mushrooms. So these are mind-altering drugs. Kids will often use these at parties or on the weekends. They might say, they're going on a trip, or they just recently went on a really great trip. Definitely inquire a little bit more if they're not giving you too much details about whatever that trip was. It might have been with a hallucinogen. Narcotics, so these are the big ones. So we've got heroin, morphine, oxycodone, and fentanyl. Heroin and morphine are going to be obviously a little more difficult for your kids to get. They're most likely going to have to get that off the streets and from friends. And so you definitely want to be curious about where these drugs are coming from, specifically because right now with the opioid crisis in the US, a lot of people are overdosing and dying from fentanyl being placed in these drugs. And so in a later slide, I'll kind of outline some different questions to ask your kids about their drug use. And then oxycodone, those are those really strong prescription meds that your doctor might have prescribed you after a surgery. So again, having those locked up is really important. Stimulants, so nicotine, tobacco, cigarettes, vaping, Adderall, Ritalin, if your kid has a prescription for ADHD medication, it might be beneficial to administer that yourself, make sure that they're not abusing that drug or selling it to other kids, cocaine, and then we have meth. And then other drugs, we've got bath salts, inhalants, spice, and salvia. And so right here on the side, you can see that mostly teenagers are really engaging in marijuana use at about 7%. Then we've got alcohol to the point of binging alcohol, so 5.8. And then the next one is cigarettes, 4.2. And I would even take a guess that more recent statistics would include vaping a little bit higher percentage-wise as well.
Yeah, definitely. And so some of the signs of, I'm sorry, were you going to add anything, Serena?
No, go take it away.
Some of the signs of adolescent substance use, as you can see, there's several on there. One of the more obvious are paraphernalia that's out in the open that you might find in their room, maybe in the car, in their bag. However, you often will also see physical, emotional, and behavioral changes. So, for example, stimulants, like Serena talked about, so those, it could be, the ADHD medication, meth, cocaine. So you'll see, irregular heartbeat, which you might not know, but, the doctor could maybe see that in a physical. You might see insomnia, irritability, unexplained weight loss. So opioids like Vicodin and Percocet and heroin can cause a lack of enthusiasm and energy, constipation, slowed breathing, pinpoint pupils, and nausea. And some behavioral changes you might see is, loss of interest, kind of like the criteria we talked about earlier, loss of interest in hobbies, extracurriculars. You might start hearing from teachers, classmates, friends about their behavior change. You might see a change in their friendships. Definitely probably see some mood swings, some kind of highs and lows of being angry or irritable, or maybe argumentative, unusual agitation, restlessness, hyperactivity. And on the other end, you might see a lack of motivation, them being a little more lethargic, just lack of energy. And also you'll see, a lack in a decline in grades. You could also see risky behaviors such as sexual risky behaviors, driving under the influence. So a lot of these symptoms overlap with mental health disorders. So that's why, like we mentioned, it's important to understand their behavior and symptoms to get that properly diagnosed, so you know kind of what is feeding what, or that they're just getting the correct treatment to address either disorder. Okay, Serena.
Yeah. And so there's several different approaches to handle substance use. I'm going to talk a little bit about the harm reduction model, and then Danielle will talk about the MST abstinence model. And so harm reduction is simply a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. And then, so some sort of tips and tricks within the harm reduction model: become information seekers. The more you know and the more your teen knows, the safer their use is going to be. Harm reduction comes from a non-judgmental place. You remain curious, and the idea really is to reduce their use while increasing their involvement in pro-social behavior. And I believe the next slide I'll kind of go into some specific questions to really enhance and take on that harm reduction model with your kids. Danielle?
So the other side of that is, I think it can go hand in hand, but if you're looking at it from two different perspectives, you definitely have the other side of it, which is abstinence, which is not using at all. And so in multisystemic family therapy that, specifically addresses substance use, that is the intention, and the goal is that the adolescent is not using any substances at all, based on the contingency management program, which would include like drug urinalysis screens, and that would be, those results would cause either them to get a reward or a consequence. So we kind of talked about that earlier. And, part of this program is a lot of structure, supervision, and monitoring. You have the bag checks, phone checks, which I'd recommend to any parent. If you're, definitely use your instinct. If you're thinking, something's not right, something's up, it might be good to check their phone. And that can be, you can basically leverage their phone with their behavior. So if they're not giving you their phone, then they would basically lose a privilege, and vice versa. They could earn privileges. But another big piece of this is, engaging in pro-social peers, in activities, staying busy, going to school, and then family therapy. And Serena will talk about that next, on how to build that connection and open communication.
Yeah, so here I kind of have the what, who, where, why, how, talking to your team about drugs and alcohol. And so people use questions directly or what makes sense for you as far as questions go. So we've got, what are they using? What benefits are they getting from use? Who are they using with? Who do they get the drugs from? Where are they using and where are they getting the drugs from? So this is a really important one when it comes to harm reduction and just the overall safety of your kids. You want to know where the drugs are coming from. Like I mentioned before, right now, if kids are getting drugs off the streets or from friends, there is a likely chance that they are not getting a pure substance. And this is where we see overdoses and kids getting really sick or dying from drugs. So please, if anything, ask your kids where they're getting drugs from so that you can try and educate them and get them to be using something safe. When are they using? When do they crave use? When do they not use? So really trying to identify, are they bored? Did they just get into a fight with their partner? Are they failing a class? Do you see increases in use around those negative events in their life? So kind of really trying to dig deep and see what patterns you can find. Why are they using? Why are they using that particular substance? Like we mentioned before, different substances give you a different effect. And so why is it that they're using the drug that they use? And then lastly, how are they using the drugs? So is your kid smoking, snorting, intaking it orally, or injecting the drug? Again, this brings another layer of safety, especially when it comes to injecting drugs. We want to make sure that they're doing so safely if they are, to prevent diseases like HIV and Hep C and all this other not so great things that you don't want your teenager to have. And then how is their drug use more important than other things in their life? So really getting into the values of it. What do you value about your drugs that you don't value in life? So reminding them of their friends, their sports, learning how to drive, going to college, things that they want to be doing in life. And then some sort of just like quick tips. I know we've kind of thrown a lot of information at everyone. First and foremost, remain curious, offer empathy and support to build that connection. This is not a one-time conversation with kids. This is an ongoing conversation that you can start having with your kids as young as 12 and as old as 18, 22, 24. And so have these open conversations with your kids and build that rapport so that they know that you can be someone they can talk to. If they have questions about drugs, if they are in this unsafe situation, you want to be able to be that person of contact for them. Like I said, have open conversations often. Do so in a safe and comfortable place for your teen. So maybe not in the car where they can't escape, but sort of meet them in a middle ground, somewhere where they feel safe and comfortable, whether that's the living room, their bedroom, wherever you think they would feel comfortable so that they can be more open with you. Like I mentioned before, lock up your prescription medications and also your recreational drugs in your home. So like we mentioned, marijuana is legal in the state of Colorado. And so if you are a recreational user, do you have that locked up? If not, lock it up. And then safely dispose of prescriptions you don't need. So if you're hanging on to those prescriptions from a few months ago, a few years ago, talk to your local pharmacy and they'll be able to help you safely dispose of them. Do not put them down the toilet. Do not throw them in the trash. Please just speak to your pharmacy about how to safely dispose of those drugs. Seek help from professionals. And so big shout out to all of you for attending this webinar and taking the opportunity to learn. And if you feel like anything we've really talked about tonight sounds like your child and you think that your child or you yourself need some support, please reach out to professionals and we'll go over a resource page soon. And then lastly, self-care. Taking care of a family in general, taking care of teenagers going through puberty and going through high school can be a taxing job. So make sure you're taking care of yourself. And then to add on top of that, if your kid is struggling with mental illness and substance use, it's even that more important to take care of yourself. And so reach out to your ecology, reach out to your friends, to your partners, and really lean on others for support because you're not alone.
Definitely.
Danielle?
Oh, yeah, I could go over. So we have a few resources. So treatment options, here at Denver Springs, we offer the intensive outpatient program for adolescents. It's actually run by myself and Serena. We usually have 2 different groups, and that include addressing substance use. And so if you're interested, we provided the link you can give, and we also have the phone number on a different page here. But really, you would give us a call, and we could kind of assess and see if we want you to come in for a more, a more in-depth assessment to see if your adolescent meets criteria for this level of care. But there are other treatment options. There's the MST treatment that I was talking about. That's through the Synergy program. That's through addiction research and treatment at the University of Colorado Anschutz Medical Campus. That's actually in-home intensive substance use treatment. So we can, there's the link, and so you can also explore that as an option to see if that would be appropriate. And then there's also other options. There's Sandstone Care, residential options that where they would be placed out of the home. Of course, that would be more severe, and we definitely would want that to hopefully be prevented. And then there's individual therapy. We just provided Psychology Today for really, there are licensed addiction counselors, which myself and Serena are going for, where you get specific training and education and experience in addressing substance use. So we highly recommend that you go to someone who is trained for substance use to get the best care possible.
Mm-hmm. Yeah. And then again, a big thank you to everyone for watching this webinar this evening. I've provided Danielle's email here as well as my email, and then Denver Springs Main Hospital line. So please feel free to reach out to us if you have any questions or need additional support. We are more than happy to kind of chat with you and see what would work best for your teen and your family. And then I also just kind of on that tip of self-care for yourself, Denver Springs is opening up an awesome intensive outpatient group called the Caregivers Group. And this is for individuals just like yourselves who are taking care of others during their mental health crisis. This could be parents, loved ones, grandparents, anything like that. So if you are also interested in that and think that this would be a great support for yourself, please call that number that I have right there as well. Danielle, do you want to just go over the last 2 resource pages? I'll just go over them quickly. And so, we only had a short time for this webinar, and so we wanted to put in as much as we could, but we also left a lot out. So here are some links to some fact sheets that you can take a look at, and then as well as other resources that we use to create our presentation. And I do know that I will be sharing this presentation with Jamie, and he will make sure that everyone who's attended the webinar will receive a copy, and it will also, I believe, be going on their Douglas County website, I think. So it will be accessible to a lot of individuals in just a little bit. So yeah.
Thank you, Danielle and Serena, so much. That was amazing. That really gave some great information and helpful tips for so many parents of teenagers who they might not even be directly dealing with this. They could be indirectly through a neighbor or family member, but that was a lot of really helpful information. And so we appreciate your time and your effort and all that you guys do for our youth in Douglas County. We do have some other webinars recorded. So you brought up about, having these conversations with your kids, right? We did have a webinar called Building Connection Through Hard Conversations. So if anyone who's listening tonight, if that interests you, please just go to the DCSD YouTube, I don't know if it's a station or what it's called, but the webinar is there. And then next week, we're going to be doing a webinar on creating the life you want. developing a culture of appreciation at home. So thank you, everyone who's listening now and who listens just from our recorded session. We appreciate you. And thank you, Denver Springs. And thank you to Genevieve Frazier for helping put this all together for us, and to Jamie. So good night, everybody.
Thank you. Good night.